Record. Okay. Hi. So,
Hi.
thank you so much for being with us here today. We have a guest here today to talk to us about maternal mortality and nutrition care for pregnant populations and just all of the things. And I'm really excited because ShLanda is not only an advanced CD donor, but also CDR eligible. So she's in the whole world of birthing and nutrition. And she's the founder and executive director of the National Birth Coalition, which is a registered 501c3 nonprofit organization out of Winston-Salem, North Carolina. ShLanda got her BS in food and nutrition at the University of North Carolina at Greensboro and another BS in nutrition and dietetics at North Carolina Agricultural and Technical State University. Then she went on to do her dietetic internship at Oakwood University in Huntsville, Alabama, focused in medical nutrition therapy. And she has been all over the landscape, completed research in the role of birth doulas and increasing breastfeeding rates. She supports women of color in her local town, but also nationally. She's just done so many great things. So I'm really excited for her to be here with us today. And let's just start off. Why don't you tell everybody a little bit about what you do with nutrition services and what your practice kind of looks like on a day-to-day basis?
Okay. Thank you, Hope, for having me. I really appreciate this opportunity to speak with students in the nutrition field. Maternal health is everything to me. And like I said, I really appreciate this opportunity. The type of nutrition services that I offer right now, it's a lot of contract work, but it's primarily group nutrition, group maternal health focused. As I am like a community birth worker, some of the contract work that I do is educating and listening to the stories of Black and Brown women and their birthing experiences. Here in Forsyth County, for example, our preterm birth rate is very, very high. And when I say that, if you look at the March of Dimes report card, they have us graded. They have a grading system, and it's graded A through F. Well, here in Winston-Salem, we have an F. So preterm labor is where my focus is right now, and making sure that the community understands what they can do with their autonomy now to increase their rates so that they don't have a lot of preterm births and labor. So nutritionally, that's the other side of my work, which is making sure that women understand the importance of not having deficits in like their vitamin D, their iron, and really giving the education to groups of women when they are deficient, what they can do and how they can do to work on their lab results. And unfortunately, it's a lot of work to do when we don't have a lot of the resources in the Black and Brown community to increase a lot of those lab levels.
Yeah, so that actually kind of rolls into my next question for you. And what made you interested in having a career supporting families of color, both as a doula and a nutrition professional?
I'd probably say COVID changed a lot of people's lives, but I don't think I knew the impact it would have on my life and the work that I was doing. I was all ready and set after, my dietetic internship to just be like, yeah, I want to take the exam, that was just like the really main focus that I had, because that's just usually the natural order of things. You do your internship. But when COVID came, something like really deep inside of me was just like, no, that's not important. That's not as important as you starting a nonprofit. A nonprofit to help women and families, just birthing people, understand the impact that we can do, I guess, to help each other and to help the community. So that kind of derailed a lot of thoughts that I had, because the hospital landscape changed with COVID. We had a lot of people birthing by themselves. And birthing already is a fearful, scary thing for a lot of people. But to imagine people going to the hospital by themselves, that was the most traumatic thing that I could have imagined as a birth worker. So having to change that landscape, create the nonprofit in order to help people not be by themselves giving birth for the very first time. There was a lot of policy changes in the hospital. So I wanted to be there to be with the community.
Yeah. Can you tell us a little bit about how that changed in your area? Because it might look different in different areas of the country.
Okay. So pre-COVID, because that's the way I can explain it now, pre-COVID, before COVID, as a birth worker, as a doula, I literally had my client, the client found me, and we would just prepare to go into the hospital. They hired me, we had a contract, they hired me, because that's what being a birth worker is about. Being able to choose who you want to be in that birth space with you when you're giving life into the world. So that's the way it's always been. When COVID came, all of a sudden we saw a shift, like a major, major shift in the hospital policies here in Winston-Salem. And what that meant was it was no longer my client being my client. It's now I had to almost work for the hospital as a vendor doula or a vendor contractor. No, they don't pay you at the hospital. No, there's absolutely no pay from the hospital, but I had to pay them to go into the hospitals.
Oh, man.
The very first time ever in history here in this area that I have to, or all the birth workers pretty much have to pay to go into the hospitals to support our clients. That was impactful for a lot of reasons, but the main reason it was impactful is because the fees were exorbitant. It was, I want to say maybe $300 to $500 just to sign up to be credentialed as a birth worker in that vendor system. Then on top of that, we had to pay for drug screenings. We had to make sure that we had our immunizations done. We had to make sure that we paid for, like, I guess we had to, of course, have masks, but those weren't provided by the hospital. But everything, especially making sure that your business was as sound as possible. So let's just say if I was volunteering to go into the hospital, you'd probably rack up at least $1,000 if you just wanted to volunteer to go into the hospital if you weren't getting, assistance from a client. So It was very traumatic as a birth worker to already be hit with, the requests from the hospital. But on top of that, it was almost like a slap in the face if you just wanted to do this as a side, just being a gift to your community. It was no longer a gift. You had to pay to be there.
And I mean, that almost triple, quadruples the burden, because either you have a really sound practice and you can afford to do that, no big deal, or you can pass that fee on to your client. But then in both of those situations, that makes access for the people who have a lot of money, not for the people who really need the support and who are bringing doulas in with them because they're scared for their life being in the hospital. That's just so stressful.
That's exactly what it was like.
Okay. Yeah, so that's just I can't imagine being in a situation like that. That actually also makes me think, what role do you have as a part of the care team when you provide services to these families? Because pre-COVID, you're saying we just went in, we prepared with our clients and we just went in, but what is your role in the care team now that all of that has shifted and we've settled in a, quote unquote, post-COVID world? How has that changed and what does that look like?
Well, from a larger standpoint, like just as a Black and Native woman, it was very impactful for other Black birth workers in the community. When I say for a whole healthcare system that has over 325 locations throughout the South, like North Carolina, South Carolina, and I believe Tennessee. I might have the states wrong right now off the top of my head, but let's just say that this hospital system covers like two states or three states, right? There was only 3 Black birth workers that could have afforded to even go and support their Black clients.
Oh no.
So that type of impact, that's the big picture, right?
Mm-hmm.
3, there's only 3 of us that could overcome the barriers and the obstacles to get in. Now, as we, conversated between us as birth workers, what it's like for us to be part of the healthcare team when we go in, a lot of disrespect, I think, has happened. The staff has even, and this didn't happen to me because I think one of the things with me is they've seen my face through the years. I've been a birth worker for 12 years, 13 years now. So the hospital, the OBs, they're used to me and my face. They've seen me for years. But for the ones that were brand new birth workers here in the area, I've heard them say they were asked like 5 times, 6 times in the birthing setting with their clients, are you certified? Are you a vendor? Just kind of like that nasty, connotation, like, did you pay to get here? What's your role? Are you official? So that type of disrespect is what I've also seen happen to the Black birth workers that have jumped through the barriers. So it's almost like they took us back in time, like 12 years, 13 years of my birth work. And then now to be the only Black birth worker, in my area that has made it through the credentialing process for the hospital. It's like being all over again. It's like I started off as the very first Black birth worker in my area, and literally I still am. When we were starting to gather steam with birth workers, getting their credentials, being certified. But I think for me, it's just a little bit different with being with Donut International and having that I'm over the whole southern region of the United States. So it's a little bit easier for somebody to Google my name and realize, boom, oh, that's her, Mm-hmm. Whereas a brand new birth worker that's Black, mm-hmm. that's not going to be as easy for them.
Yeah. And I mean, talk about systematic racism in total action, because like I said, all of these fees come along, ends up being the people with money, and just systematically as a society, we've really done gatekeeping with resources for white families and people that have a lot of money. So that just amplifies, on the professional side and for the families. So, and I know you and I both know this, but can you share a little bit about why doulas are so important for families of color, why they choose to work with birth doulas?
Well, just historically, I'm part of a project called Forsyth County Birth Stories. And that project basically allows Black women, brown women to be open and honest and discuss what their birth experiences are like. And the trauma and the fear that has been installed in the psyche of Black and brown people, birthing people, is something like I've never seen or heard before. And I've been doing birth work for a while, but the impact of having to birth alone, not having the education, not having the understanding of that body autonomy, it was gone. It's been gone for Black women for a very, very long time. So that is the main reason why a lot of Black women, a lot of Black families, a lot of Black birthing people seek out the help of a birth worker in support when they're in the hospital setting. The traumas, it's the words can't even explain. Trauma is a very, like, it's not even that's just a word. Yeah, it's not even hardly even appropriate for some of the stories that I've had to hear in my role in the in the Birth Stories project that I'm working on right now, that program. It's just, it's like a nightmare. It's almost nightmarish of some of the things that have happened to Black people, Black women, Black birthing people in the hospital settings.
And doulas, they bridge that gap then of advocacy and making sure that someone knows what the goals are of that family, and being the person that's going to, so when they're in that vulnerable state, that's going to stand up and say, whoa, no, that's not the plan. We're not going that direction. In addition to all of the birth support that you give with, managing pain and all of those kinds of things.
Yes. The physical support, definitely. My best tools are my hands. When I'm with a birthing person, I probably say, my head trying to think, okay, what does this person really, what are their goals? So having those plans written out before we even go in. The strategy, for example, of if she wants a natural birth, well, how far is she willing to go before she, decides, if she even decides she wants pain medication. Mm-hmm. It's so many different levels of birth work when you go into a hospital, but also even people, Black people having the option to have a home birth here in North Carolina is very, it's almost unheard of unless they're going underground because of that fear. But yeah, we had that educational support, we had that physical support, and that emotional support to really truly have the birth experiences that people want, Black people desire,
and deserve.
Deserve, yes, deserve, yes.
Yeah.
So really, truly working with the underserved population, having to re-educate a lot of people in the underserved population as well, is it's where my heart's at. It's where my heart's at. And
that's
being able
amazing.
being able to have the nonprofit now, that has really opened a lot of doors and also helped me speak to a lot of people about the issues that we're having with birth workers here.
Wow. So what parts of your job are similar and what parts end up being different when you're working with a family of color? And I know that's a loaded question because it's a lot, but I'm almost trying, I can't ever experience what you experience, but just from your perspective, what do you feel like changes because you're in it serving these different populations?
Okay. It's easier probably for me to talk about the white population that I've worked with first.
Yeah.
And even though there are issues with white population too, for example, like if it's a mixed couple, a Black father, white mom, like those different types of issues come up as well. But if it's just a white couple, I can almost say I can breathe easier. I can be rest assured she's going to be okay. They're going to take care of her. They're going to read her birth plan. Mm. They're going to actually pay attention because it's more obvious that, I might not be a family member, walking in there with them, So on the flip side of just that basic, when I walk in with a Black family, the first thing is, oh, she's just a cousin. They think of me, oh, she's just a relative, very flippant. They don't really know who I am, for example, depending on what shift, it's 3:00 in the morning, its staff is very flippant. but not until like, I pull my hair back and show the badge, do they're like, oh, you are not family. Let me tighten myself up some, So that difference, I think that major difference is the ease and comfort with the white family has versus a Black family that is just like, I go in making sure they're on guard and we're watching everything. And it could be simple as the fear that a nurse installs automatically with a Black woman. Oh, your blood pressure's high. She didn't have high blood pressure when she walked in here, so how is it high now?
And let's try and think a little bit about what might have made her blood pressure high.
Exactly.
She's scared. Yeah.
Or just little things to rush a Black woman, like just rush them through. I've seen that a lot more with my Black clients. So it's like whatever excuse that can be used to rush the process, I've seen that a lot more with Black clients versus my white clients.
So it's almost like the white clients serve to elevate the fact that you're part of the healthcare team. Now it's not so flippant because these people who have resources and have, just by the color of their skin, have privilege. They've now this is a legitimate situation. These white people have invited this situation to exist versus a Black family who, no one's paying attention. Everyone's just kind of letting things go. Mm-hmm. So it almost serves to make you a legitimate part of the healthcare team because the white person said you are, instead of just the fact that you are because you have the education, you have the skills, you have the knowledge, you have such a long experience in this area.
That's exactly what happens, like every single time. And it's almost like it's shameful that these biases are so, like, there's no shame in it with a lot of the practitioners. This is our healthcare people. These are our healthcare staff at one of the finest hospitals we have here. But the biases, just as soon as you walk in the door, depending on the color of your client's skin, and they exist. They've been existing, but it's, like I said, it's shameful that the system has made it okay to do.
Yeah.
For so long. And but the fear, I want to say, is the other thing. A lot of times the white clients, they know they're going to be okay. They don't have that same level of fear. Whereas Black clients that I have, no matter how much preparation, it's almost a fear of having that cesarean section. Like that is the fear. Being cut on, not being listened to when they say they don't want a medication so quickly. But those interventions, they move real fast with Black clients versus white clients. The interventions and how fast they come about, a lot faster with Black clients than white clients.
It's heartbreaking. I don't work in a hospital. I work obviously you get to go see in the hospital more. It's so overwhelming to think that that's the system that exists to provide care for our population. So are there any other challenges? We've spoken a lot about this, but are there any other specific challenges you see families of color, Black and brown families facing within the medical system during pregnancy that is a result of the fact that they are Black or brown, not any other reason except for this? That's the reason they're being systematically discriminated against.
I'd probably say when, more than anything, I just see with my Black families facing a lot of people that are unwilling to be empathetic. The staff unwilling to put themselves in somebody else's shoes. For example, I think one of the things we used to say a lot was, treat somebody like, you would want to be treated, treat somebody like you're working with their mom, a family member. That doesn't happen. when I'm working with Black clients most of the time, unless you happen to have a Black nurse or, you know, a nurse of color that's empathetic. I probably say it's very hard for a lot of the white nurses or healthcare practitioners to not have bias or even show their racist attitudes. Because when I tell you, they really act and almost say, "Oh, you're stupid. You don't know. I know best for you." I even had a doctor tell me at a prenatal visit, OBGYN office here, that it's great what I do, ShLanda. It's great what you do. It's great work that you do, but women and families, they'll never know how do you put it? Women and families will never be able to learn and know better than I can tell them. And that overarching theme of that doctor saying that to me has probably been the most eye-opening experience that I ever had a doctor say, and pushed me to the point of, oh, we're going to learn. I'm going to make sure it's my business to teach every person that I talk to, that I come in contact with, that's pregnant and getting ready to birth in this hospital. Yes, you can learn. Mm-hmm. This is your body, and right. Giving them the autonomy to even challenge when they hear a doctor say something like that to them, or right. Even feel that. But yeah, I just wish that more doctors and staff people would be empathetic and willing to not have these mentalities and old racist mentalities, you know, not giving pain medication during an epidural, things of that nature. It still happens today. Not being giving episiotomies. It still happens today. So just making sure that clients know that Black or white or whatever skin color, or that they have the right and they have the ability to learn what's going on in a birthing situation.
Yeah. And that's so sad. And I know as a lactation professional, I feel that attitude from other healthcare providers, not everyone, but definitely some, that there's never anything that you could learn that'd be better than what I can tell you to do for yourself. And it feels very overwhelming because I really want to be like, you're not in their brain. You don't know, like, they know their body. They know what's going on. When there's something wrong and they're saying there's a problem, they know themselves. It's just, it's very, this is why I don't work in this. My students that know this about me, this is why I don't work in a medical system, because it's enraging, literally. Like, and I am from the North. I'm not the Southern, like, put a smile on your face. I'm like swearing at the people. Anyways, now that I'm done with rabbit hole, is there any advice you would give to our future healthcare providers about making sure they are giving equitable care in their practice?
I'd probably say the most important thing that comes to the top of my head is, especially with this being Monday after Roe v. Wade came down, like this is the very fresh type topic in reproductive health, reproductive justice. So all I really can say right now is it could happen to anybody right now. The disrespect, the level of just not caring, and people wanting control over your body, period. It could happen to anybody now. Yeah. And I think that if you are a new medical professional in the health care system, you don't want it to happen to you. So don't do it to anybody else. That's the main thing I can say, because right now, like I said, with the fresh weekend and Fridays and what's been happening here, Yeah, reproductive health is everybody's business. And having a baby, having a child in this day and time, there's some things that you can do, and making sure that people have that, um, checking your own biases, getting that type of education, inclusive care. That's more critical now than ever before. So I definitely say, get your education, and please just treat people truly like you would treat your sister, your brother, your mother. And remember that it's not complicated. Just treating people right, treating people fair, and leaving those racist attitudes at the door, those biases at the door, because it doesn't help anybody.
I always think that made me think when you're saying that is when what we talk about with counseling skills is you need to be listening to your clients to learn, not listening to respond, because you can't make a good plan of care no matter what type of provider you are, lactation, nutrition, doula, medical doctor. You cannot make a good care plan without listening and knowing and believing what they're telling you, because your intervention is not going to be effective if you don't have the whole picture, right? And we talk about that a lot in these spaces about, and this is specific to lactation, but a lot about, well, they have to go back to work in a couple of days, and they're choosing between feeding their family and pumping milk. Like, I mean, let's talk about the level of what are we prioritizing? So if we need social support, these little nuanced things about if they're choosing to breastfeed, if they're choosing to advocate for themselves in a medical situation, those all become back burner when you're like, well, does my kid at home have food? Are they safe walking outside? All of that other stuff falls to the back because just their basic safety is not intact. So it's really.
That's exactly right. That's exactly right. It's like I said, like you were saying, the basics, until you ask those questions and listen for those responses. A lot of times, especially in marginalized communities, Black and Brown communities, the basics aren't even there. So listening and asking those questions that really dig deeper than just the surface answers that, we're almost programmed to give an answer to, right? It's not that way anymore. And even with me having to dig deeper, because I just got elected to the Urban Food Policy Council, looking at some of the policies, that would be another thing that I would say new healthcare professionals need to really look at. And with the eye of, is this responsible to have a policy like this when you have a preterm birth rate of F grade in your city? Is it responsible? And think about what you can do if there's not access, for example, to water to people in your city. That's one of the other problems that we're having. Okay, we don't have access to water in certain parts of the city. In the food deserts situation, there's 21 food deserts in my city. 21. So thinking a little bit more critically as a healthcare practitioner will do a lot of good when you are talking to your clients. It's not as simple as, oh, let's just, go to the grocery store. It's not that simple.
Do you think I wouldn't have done that if I could have done that? Come on. Yeah.
Exactly.
You don't think I tried it already?
Right. But sometimes they just think it's just so surface level, but it's really, like you said, listening to the motivational interviewing and really being a lot more critically willing to dive more into those questions to ask your clients, not just surface. It's really an important part of your job, really important part of your job as a new healthcare professional.
Well, ShLanda, thank you so much for sharing your time and expertise with us. I'm just very honored to know you, and all the work you're doing is so inspiration. I mean, I don't know how you're involved in so many things, but it's so fantastic and it's so needed. But thank you for taking your time this afternoon to share with us about what you're learning and what you're doing. And for everyone that's listening, I'll put some links to the spaces that ShLanda is active in the area so that you can learn more or get involved. If you're in that area of the country, get involved. She probably needs volunteers, I'm sure, for nonprofit, lots of different opportunities. So, and yeah, so thank you very much.
You're welcome. Thank you so much. You all will be great healthcare practitioners, and I wish you all the best.